So today's question is, a patient presented with history of sunburn after few minutes of exposure to sun, freckling and changes in skin pigmentation. Biopsy from one of the lesion was reported as basal cell carcinoma. The appearance of the child is shown below. The given condition is due to what? Mismatch repair defect, nucleotide excision repair defect, recombination repair defect, or both A and C. Okay. So, going back to the question, it's a young child who has got a lot of dermatological lesions following exposure to sun, and there is basal cell carcinoma. Usually, basal cell carcinoma doesn't occur in a child of this age group. So, when you see a lot of reactions of your skin and an early onset of basal cell carcinoma, you have to suspect some defect in repair. Okay, so what is the answer? So when you take disorders or DNA repair defects, so many DNA repair defects can lead to malignancies. So disorders of DNA repair or DNA repair defects can be due to nucleotide excision repair defects, mismatch repair defects, and recombination repair defect. Okay, so it could be, you can remember as NMR, nucleotide excision, mismatch repair, and recombination repair. So when you have the problem with this DNA repair, so whenever your DNA has got some damage, it has to repair. If it's not repairing, then we tell that there is some defect in DNA repair. So if it's due to nucleotide excision, you can get a condition called xeroderma pigmentosa. Okay, when you have defect in the mismatch repair genes, you have certain genes which are going to repair the mismatch. If they are defect, you can get something called HNPCC, hereditary non-polyposis colonic or colorectal carcinoma, or the Lynch syndrome. When you have defect in your recombination repair genes, you can get either Bloom syndrome, ataxia telangiectasia, or Fanconi's anemia. Okay, you can get either of these. So Bloom's, ataxia telangiectasia, and Fanconi's anemia. Okay, so these are the defects in DNA repair mechanism: your nucleotide excision, mismatch, and recombination. Now going back to the question, this child has got a basal cell carcinoma. So basal cell carcinoma in a child, it's usually due to defect in nucleotide excision repair. So the given condition is a xeroderma pigmentosa, and patients with this condition can develop multiple squamous cell carcinoma and basal cell carcinoma. So obviously the answer here is a nucleotide excision repair defect. Okay. So apart from this, few points about BCC. So when you histologically look into a basal cell carcinoma, basically they are blue cells. You have nest of cells which are having a peripheral palisading. They show peripheral palisading, and in the small stroma you can have some mucin. You can have mucin. Okay, and usually BCC is due to mutation in a gene called patch G. It's due to mutation in a patch gene, and when you have these mutations, you can develop a syndrome called Gorlin syndrome, which I have discussed in previous videos. Okay, so Gorlin syndrome is due to mutation in patch gene. It's one other condition which predisposes to the development of basal cell carcinoma. Because you get basal cell carcinoma, this is otherwise called nevoid basal cell carcinoma syndrome. Okay, so remember, BCC can occur when you have defect in DNA repair due to nucleotide excision repair defect, or due to mutation in your patch gene. Thank you.